Hey everyone, welcome to a special edition of Why Should I Trust You? This conversation may be one of our favorite big moderated Zoom discussions we've done yet. It's with a group of Gen Z folks who are interested in thinking and acting on our nation's health, even if they don't all agree politically, tactically, or even philosophically. Some are studying for a career in public health. Some have started their own organizations to meet the health challenges of the day. Some are aligned with MAHA, others more conservative, yet others more liberal. They're all over the map when it comes to which quote-unquote group they identify with. But one thing is clear. They all care deeply about health in this nation. We talked about systems versus individual approaches, about MAHA and Kennedy, about what expertise meant to them, and about how to reach them as Gen Z. And we discussed the impact of the murder of Charlie Kirk on their generation. It was a truly special conversation. We can't wait to share it with you. Let's get started. Hey, everyone.
Yeah, welcome, everybody.
So we have a treat in store today. I just love this episode so much. We've already had the conversation. It was just so good because our kind of thesis here, Tom, is that our generation, Gen X, has sort of screwed everything up.
Yeah, us and the boomers. Don't just blame it on us.
Yeah, okay. So boomers and Gen X, we kind of fucked everything up. So it's time to talk with the generation that might save us all. Or will they save us all? No pressure. So look,
stay tuned.
As you heard at the top, we are talking with a big group of mostly 20-somethings today. There's one 30-year-old that snuck in there, but he's so good. We just let him have it. About trust and health and medicine and science. So they're a group of Gen Zers. Maggie, are you Gen Z? You're like kind of Gen Z, right?
No, I'm not. I'm a millennial, an elder millennial, if you will.
Younger. You're a younger millennial.
You're a younger millennial and like a in hospice Gen Z.
Yeah. You're just
in
on the border.
hospice Gen Z, yeah.
There you go.
Yeah, just on the border.
Now we're old, Tom. I think we've established that. Now we've talked about when we were born. Let's actually say who we are. I'm Brinda Adhikari.
Yep, and I'm Tom Johnson.
And I'm Maggie Bartlett.
Yeah, Brinda and I are journalists. Maggie's a virologist. Dr. Mark will be back in the next episode. And you are listening to Why Should I Trust You, which is a podcast that very narrowly examines the breakdown in trust through the prism of generations.
Yes.
That's what we do. Always.
Through the generational prism.
No, it's very interesting. This conversation, it's just interesting on so many different levels. These guys are just phenomenal. So we're psyched to give that to you.
Absolutely. And I want to give a big shout out to Chelsea Cipriano. She's been on one of our episodes before. She's from the Common Health Coalition, and she pitched this idea to us to kind of have a conversation with Gen Z about health. And so, Tom, just like set the table before we have this conversation. What do we need to know here?
Yeah, so let's just talk about the generations that right now are navigating this moment of our post-trust era in science, health, and medicine. Of course, we got the baby boomers. Those are like 60 to 80-year-olds. You know, think Woodstock, Vietnam, civil rights movement.
Shout out to my mom right there.
Shout out to Brinda's mom. You know, they're generally considered like loyal consumers. When it comes to health, you know, this is the folks that trust the doctors, trust the scientists. You know, some even think it's like rude to ask a question to a doctor. Then you got Brinda and I, Generation X. This is 45 to 60-year-olds, kind of Cold War kids, grunge, first computers. You know, they're generally considered independent, but skeptical. You know, more skeptical than boomers, not as skeptical as the next crew. You know, we'll dig through a lot of different sources, but still take the doctor's word at the end of the day. Then we got Maggie, millennial, 29 to 44. Really grew up with tech, came of age after 9/11, 2008 crash, formative experience. This is Facebook, Harry Potter, you know, health conscious, but really blending advice from social media with the guidance from their doctor. And Maggie, that brings us to Gen Z, the folks we're talking to today.
Yeah, so we're talking to Gen Z, which runs from 13 to 28 years old. They're the true digital natives. Many had a phone in fourth grade, which is so wild to me. They felt the pandemic school shutdowns, which we talked about a little bit today, and it was the most visceral for that generation. They're known for getting their news from TikTok, and they prize authenticity above all, but are very deeply wary of institutions.
There's a lot of polling on Gen Z. You know, Edelman, that's the communications firm behind that annual trust barometer. They look specifically at 18 to 34-year-olds, which of course just captures a big slice of Gen Z. And here's what they found. They said that when it comes to health information, these young adults lean heavily on peer-to-peer sources, so friends, family, social media. And they're tuning out to some extent what they termed provider advice, meaning guidance from doctors. So social media and the experience of your friends, your family is becoming more trusted. Doctors less so. In fact, nearly half of those surveyed said that they would stop trusting or even stop seeing a health provider if politics got in the way, which is quite something. On vaccines, nearly a third said they'd give their children only some of the available shots. And, that was evident in this recent KFF Washington Post poll that we've talked about here, which found that parents under the age of 35 are also less likely than older parents, particularly Gen X parents, to say they're either very or somewhat confident that routine vaccines are safe for children. And then finally, Gen Z is consuming and sharing health news, health information more than all the other generations. They share across all the outlets, podcasts, they share clips from newsletters, and they're much more willing to post their own health experiences online. As the surveyors put it, personal experiences cataloged on social media now carry enough weight to rival the believability of data provided by the government or even healthcare providers.
Yeah, it's a real good group that we're talking to today. And it's this group of Gen Zers. And when we come back, we want to tell you a little bit about the group, and then you'll get a chance to listen to this conversation. We will be right back. Okay, welcome back. And we brought together a group of Gen Zers here to talk to us a little bit about this moment in health and mistrust and who they trust and why. And so they actually introduced themselves on the conversation, and we're going to get to that in just a minute because I want you to hear it from them, who they are and how they see themselves. And look, it is a big group of people, and some may ask, why do we have so many people when we do these conversations? I only partly do this to make an episode out of it. Another reason I do it is because I just want to bring people together to have these kinds of conversations. And a lot of them tell me that they like when there's kind of strength in numbers and they feel represented when they see others in numbers there. So it might be a little hard to sort of keep track of who's saying what. We hope we make it easier by people identifying themselves and us introducing them and us saying their names and things like that. We start the conversation by just kind of asking them what they think about this present moment in health, and particularly who's in charge at HHS. Let's take a listen.
Hi, everyone. My name is Elizabeth Frost. I work with the MAHA movement as the grassroots coordinator for MAHA, Ohio. Sometimes I think the public perception, just really misses the mark on what people in the movement are actually, really fighting for on the ground.
Hi, everybody. My name is Mackenzie Isaac, but friends call me Kinsey, so please feel free to call me Kinsey. I'm based in my hometown, Indianapolis, Indiana. I study treatment pathways for Black American adolescents who experience binge eating disorder or emotional overeating.
Hi, I'm Hunter Ryerson. I am a student at the University of Michigan. I've been covering the MAHA movement for more than a year now in sort of opinion columns and discussing the policy advances being made. I've been sort of following health politics for as long as I've been politically active, and I think that's just sort of coming to a head now. And so,
hey everyone, nice to meet you. My name is Rotimi. I am a senior at UNC Chapel Hill, and I'm originally from Hoover, Alabama, although I grew up in 4 different states. I've seen a lot of the healthcare sector as a patient and as somebody trying to work to fix the system from within who doesn't have access to healthcare, or the implications of that for them.
Hi, everyone. I'm Adnan. I'm a student at Rutgers. I'm studying psychology and metabolic health. And I've kind of been involved in this health space just through my personal experiences growing up with like the typical average Gen Z experience of having a bunch of different mental health issues and then also chronic health conditions. So, and I kind of see it as looking at like the actual average Gen Z individual who's sitting in their room, brain rotting, bed rotting, scrolling on their social media all day. That's kind of where I find my interest.
Hi, everybody. My name is Nate. I'm a program coordinator at NYU's Division of Medical Ethics. I am a bioethicist. So basically, I use the tools of moral philosophy to examine anything that's going on in health, medicine, science. One of my main interest is vaccines and vaccine policy. I like to think of myself as sort of a critic of medicine and health. And what we try to do is examine what's going on and seeing if we can build better frameworks for better medicine. My interest in bioethics comes from my background in philosophy. I was a philosophy major in college, and I actually took a year off from college because I had a medical condition.
So my name is Mayessa. I am, as of 2 weeks ago, I'm a teacher, an English teacher in Pamplona in Spain. I was in DC for 2 years. I got my degree in political science. As Nate was saying, I thought what he said was really interesting about his background in philosophy, because I also agree that health is, it's spiritual, and it's like binding together spiritual and human connection.
Everybody, my name is Dorian. I'm from Long Island, New York, and I spend my days working out of my local health department as a public health educator. So I do speak with both adolescents and adult community members around chronic disease, around addiction, such as suicide prevention and bullying prevention, and really helping them to create decisions from an informed perspective on what behaviors they can partake in.
The first question I have for you guys is that right now, Secretary Kennedy and MAHA, they're in charge. So let's just ask, do you trust the government right now on health? And if not, who do you trust? Why don't we start with Hunter?
I think it's a complicated question, because I think the theme of why we have the government that we do in health and the health administration is because people don't trust the government on health. So whether or not I have a sudden trust that everything that comes out of HHS is 100% true, and I'm going to make life decisions based off of that, no. But what I do know is that this HHS isn't telling me that I should take everything they say at face value and not make medical decisions for myself. So what I'm seeing is that we have, an administration with FDA, CDC, all the way up to the Kennedy's office and even the presidency, where they're saying, do your own research. We're not going to gaslight you out of you have this medical condition or this medical condition. Instead, we're going to make an effort to give you all the tools to make the health decisions you need and not call you a dissident for, wanting to do that for yourself. So I think that that's where all that, sort of where my greater trust is that they aren't trying to dictate every health decision that I'm making or every health decision that everyone in this country makes.
Thank you, Hunter. Adnan, would you like to go next?
Sure. Thank you, Hunter and Brinda. I think that was a really interesting take. I think the main thing is regarding trust is that regardless of the time in political history or who was in power, who was being trusted, there are varying levels of involvement in the government that normal average ordinary people can have. And I think something that is very, very different about the current administration and the current health policy, especially as it pertains to trust, is that it's not just these really high-end scientists just sitting in a room and discussing things with who knows what involvement from outside sources. It's we can actually see all of the involvement of all of the people that are having a contribution in this conversation. So where historically you might have a bunch of influence from other organizations and it's all happening in a boardroom, we're actually witnessing firsthand what's actually going on. And the thing that I think a lot of people don't realize is that while it might seem like that's not happening, the reality is what we actually see is actually what's going on. There's now a lot less of a barrier between the individual that's watching what's going on and the actual happenings of the government. And that could be a good or bad thing for most people, but it's really a matter of right now, do people trust what they're saying? And do you trust what people are saying when you see what's going on? You actually see what's happening. I think that's a really nice aspect of it.
Rotimi, let me go to you next. What do you make of what Hunter and Adnan are saying, that there seems to be a barrier removed that makes it so that it's not just, and forgive me for paraphrasing a bit, but it's not just an expert class that are necessarily bringing the conversation in, that they feel a certain barrier has been removed so that people can really see directly what decisions are being made and how they're being made. Does that seem like an accurate description, Hunter and Adnan?
Yeah. I mean, I think the expert class description is an important one, but I think the distinction also needs to be made that it's not necessarily fewer experts, but it's closing this sort of revolving door between what is an expert and what is an industry, an industry person or someone who's backed by, pharma dollars or, medical industry dollars, to the extent that that expertise cannot be so trusted and that expertise is deployed for profit seeking purposes. And I think that when that door is closed, that also is a huge part of it.
Thank you for that clarification, Hunter. Let me go. I'm sorry, Adnan.
Yeah, I just want to say I agree with that. That's what I meant. That it's not necessarily just about the scientists, but the fact that it's not just like as the average person, we're not just envisioning like scientists are sitting in a boardroom and then we don't even know who's talking to them and contributing to the science. We actually see the scientists and we see what's going on, and it's being a lot more exposed rather than just being a little bit vague.
Got it. Rotimi, do you want to respond to that?
Yeah, sure. Thanks for sharing, Brinda, and thanks for all of your thoughts, guys. I agree that sometimes the government in particular can take on a very paternalistic approach with healthcare. And by that, I mean that it's the idea of we are the experts, and by that reasoning alone, we should be trusted. I think I would add some nuance to that in the sense where my trust doesn't necessarily come from the government itself, but from evidence generation. I think evidence takes a lot of different forms sometimes. That could be studies, that could be decades and centuries of prior knowledge, that could be community-built knowledge, that can be personal experience. And I look at all the evidence in a spectrum of things. And so I think at the moment, I'm a little bit skeptical of the process by which evidence is being built, challenged, and communicated. For example, I remember earlier in the year, there was a big report for Children's Health that had ChatGPT generated citations, right? And so for me, as a consumer who wants to have this ability to do my own research, to validate everything that the government is saying, I want to see the sources where they got their evidence from. A move like that can undermine the trust that I have. And as somebody who's done research, I know that sometimes it can be very messy, it can be very rigorous, it can be very slow. And so it's so important that we're able to let other people look at that research and scrutinize it, because sometimes we'll see that things are disproven later. Science is iterative, it changes. We might think we know something 20 years ago, and we find a new study 20 years later, and we're like, wait, that was not the case. Let's reshape our strategies and our frameworks. So I think at the moment, who do I trust? I trust the evidence builders. I trust people who publish their methods, who revise their findings based on the newest evidence, the institutions and the individuals who are inviting scrutiny instead of shutting it down. And I guess one other thing to address the idea of like people receiving money and being biased. I think lobbying is just something that happens on both sides of the spectrum. And so, I mean, that's kind of hard to insulate from, but I would like to think that, again, that's why I find my basis in evidence rather than individuals. For example, RFK, when he was a lawyer, he was receiving six figures from groups that weren't super fond of vaccines, right? So it's like, this is happening on both sides in a sense where people might get paid and that might influence their findings and might not. But that's why I go back to the evidence at the end of the day.
Hey, Nate, I just got one question for you as a philosophy student. Just picking up on something Hunter said about trust and how this new crew at HHS, is more often saying, you guys out there, you Americans, you do the research for yourselves. A philosophy major might have, thought through an individual's responsibility to themselves as versus an individual's responsibility to the society around them. Do you think that's a good way to go to sort of message out that it's kind of everybody's sort of in it for themselves? Everyone has to do the research themselves and make these decisions, as versus sort of what the model has been in America, which is public health creates a policy that covers everybody, and we all sort of row in the same direction, especially when it comes to things like infectious disease. I mean, how do you think about this?
I mean, it's complicated. So I think part of the reason why people have been told to do their own research, or why they've had to do their own research, is because public health has missed out on a lot of people or overlooked a lot of people. So I think that's when they had to take on more of the burden themselves. I think in an ideal situation, we could have, trustworthy systems where we could put the burden on the government or on these institutions and health systems. That hasn't been the case for a lot of different communities. And I think people, because of that, have fallen back on, their own resources or their own agency. And I think there's a lot of, at least like, emotional comfort in that and like feeling of independence. I don't know if it delivers exactly the kind of results. I mean, I think there's a lot of different things that people in the public had said that they're experiencing, that they're feeling. I think chronic Lyme disease is one thing that's been really controversial. in the public versus medicine, and people, really talking and really feeling certain things and feeling certain symptoms and living under, I guess, this condition, and medicine kind of ignoring that and not talking to that. And then they had to find their own resources. And that's just how humans work when institutions aren't delivering. So, yeah, I mean, it's a hard question. I mean, should people trust public health? Well, part of my job has been trying to convince people to trust public health, but I think, that argument needs to be made by being trustworthy, and that hasn't been done. So.
Thank you for that. I want to go to Hunter just to briefly respond to what Rotimi was saying about trust in government.
Right. And particularly, I guess I want to double click on the idea of money in politics and sort of corporate influence. I know you briefly discussed Secretary Kennedy's work as an environmental attorney or as a litigating attorney. I this past summer worked as a legal assistant for the law firm Wisner Baum. This was one of the actually leading law firms that worked with Secretary Kennedy as an attorney to sue Monsanto over glyphosate, the herbicide for causing cancer. I've had some insight through that work, but also I think just to put into perspective, right, one of the things that Secretary Kennedy has done is attempt to close the grass loophole, which allows, companies to self-determine behind closed doors what ingredients are going in their products without any FDA supervision. Right. And I think that's a great example. I think there are many instances of companies doing internal studies of their product without outside sources or corporate backed studies and things that draw very separate conclusions than what eventually comes out. And I think when we tie that into how do we trust our institutions? I mean, we are coming off of a 100,000 death opioid crisis in this country, largely driven by, practicing doctors who had financial incentives to overprescribe. And that's not my conclusion. That is a very backed, very well substantiated occurrence. And I think the problem is when we're here, we have so many health crises. I know someone discussed the chronic disease epidemic, which is sort of ramping up. We have obesity. More than 1 in 3 Americans suffer from obesity at this point. And so when the institutions have brought us here, and when the money involved all sort of corroborates this situation where how did we even get here in the first place? And so I think you really do have to examine closely when we make, and I agree 100% with your claim that, yes, we want to make the most evidence-backed and substantiated and analytical conclusions that we can. But I do think that a very clear line needs to be drawn between what does Johnson & Johnson's internal study or what does Bayer's internal study say versus what does this sort of non-industry backed, more, independent group have to say about it. And I think that distinction is really important to determining where we put our trust.
Rotimi, do you want to jump into that?
Yeah, just really shortly. I mean, Hunter, I essentially agree with what you're saying. I think to put it shortly, I believe that we need credible systems of evidence generation that we're making our decisions upon, and the evidence itself should be replicable and not something that, is only created under that simulated internal environment. But thanks for bringing that point up.
Thank you, Rotimi. I want to bring Kenzie in and then Elizabeth Frost. Kenzie, you said you had an idea.
Yeah, this is a question that I wanted to raise specifically for the people in the media space. So Hunter, I'd be really interested in your insights. Nate had this really great insight that trust is earned by way of being trustworthy. And I think that's something that we rely on a lot in the United States and just in the Western world is like the written word. When we think about asking people to do their own research at face value, that sounds very empowering. But what about people who are making decisions based off of pure emotion, pure fear? I think that the average reading level in the United States is about a 5th grade reading level. So what happens when people are just making sense of health decisions for themselves and their families based off of these fear-mongering headlines? And what role do we think that the government should play, if any, in monitoring those headlines so that the pathos of the situation doesn't end up manipulating people, even if the evidence is couched in the larger body of text?
Thank you for that, Kenzie. Elizabeth, do you want to take a crack at that, this idea? I think you're kind of getting at the notion of scientific literacy there, if I'm not mistaken, Kenzie. Do you want to weigh in on that, Elizabeth?
Yeah, I mean, I completely agree with what you're saying, Kenzie, that we are very much in a reality where to expect individuals, at a mass level to understand these complex issues that people are getting PhDs to be able to comment on is, it's too much, I think, for what the average person even wants to do. When you start thinking about, I have to get up at 6 o'clock in the morning and get the kids ready and make sure that everyone's showered and their hair's brushed and their shoes match. And then I've got to rush off to work, and my boss is stressing me out and my coworkers are undermining me, and just these very real life things that people deal with and experience just to go home and rush to the soccer game and help the kids with the homework. And where's the time? But I'm also hearing, another issue that I think is very related to public health and what you're saying, which is the reality that the average reading level in our country is somewhere around a fifth grade reading level. I think there's a very important argument in that in order for us to be able to make very informed health decisions, we have to be doing better on an education level. And as someone who works in the health space, but also in other areas of politics, I see how interconnected this is, and that our education system, not just our courses that are about health, but how are we teaching our kids to read? How are we teaching them, to engage with the healthcare system when that time comes? And I think that there's so much more that we could be doing in public education that would greatly improve health outcomes in the future. And just kind of a comment that was coming to mind as I was listening to everyone speak for the last 30 or so minutes is when we're talking about trust, I think oversimplifying what trust means can actually complicate the issue and the conversation, because in my mind, there's a very staunch difference between trusting someone's intentions and where they're coming from and trusting that they're right about what they're saying every time, or even most of the time, or even some of the time. To take it away from health and apply it to other scenarios, I trust that my sister has my best interest at heart when she gives me life advice, but she's not always right. And I trust that when Bobby Kennedy is making decisions at HHS, or discussing his views on a podcast, prior to his time at HHS, that his intentions were in the right place. Do I agree and hang on every single word that he says as fact? No. And I hope that other people don't do that either, because I think when we are dealing with something as complex as public health, we are probably amiss if we are taking something that any one particular person is saying as fact every time.
Thanks for that, Elizabeth. Does anyone want to comment on what Elizabeth said? Because I think that's and you can raise your hand, by the way, just so I can see if people are interested here. I think that's an interesting point. And I wonder, just to expand off of that, Elizabeth, if someone's intentions are in the right place, but if someone feels like they can't quite trust the information that's coming out of their mouth, right? Does it feel like that person has earned that spot of authority? And I want to just ask that, and I think it gets at one more conversation, just to put it a little bit further here, is the notion of expertise in general, right? What does that word mean to you guys? What do you hear when you hear the word expert? Does it mean anything to you? Yes, Dorian Johnson, go for it.
Stuff is being said already. I love that Elizabeth is bringing up just trust and how it's not just a blanket thing across every situation, every time, right? Where you can trust, I don't know, maybe your parents for, let's say, like getting your basic needs met, but like I don't really trust my mom for dating advice because so like even that like specific example, right? It's you could trust someone in one thing but not necessarily in other things. Not to say that like I don't trust my mom in dating advice, therefore like she's completely untrustworthy. It's like finding that balance of trust with that intention that was shared, but also like in real life practice and application. And to go what you said, Brenda, with expertise, like that is such an interesting phrase to me, and it really shouldn't be, because like there could be expertise as someone who lives with a specific condition, right? There's people who could study a specific topic, but it comes from, I know paternalism was said earlier, where like if someone, let's say, studies ticks. I know Lyme disease is said earlier too, right? So I am an entomologist and I study ticks, but I've never been bitten by a tick ever. And then there's someone who has the lived experience of with Lyme disease, and like they were suffering, how they were suffering. It doesn't feel great to have like the person, even though they have this, expertise as far as schooling and education. Oh, this is what you were feeling because of like Lyme disease. Like they can just tell you how they felt because they lived through it. And that is expertise as well. And that is valuable. So I think there is room to have all these different levels and avenues of expertise valued, but to have like someone come from a position of my expertise is more expertise than your expertise, that could get a little muddy. But like, where could they all share space? Where from what I don't say or what I don't know, can you chime in, and vice versa?
You're putting your finger on something that we hear a lot right now, which is sort of the veteran public health perspective is, I study this, I'm looking at the studies, I'm looking at populations, I'm not seeing a problem. And on the other side, often sort of from the MAHA perspective, it is, don't tell me what's happening to my sister's child is not related to the vaccine that they were given. Like my anecdotal personal experience needs to be elevated often on the same plane as your 30-year expertise studying the charts and the graphs and the statistics and the surveys. So like there's a change occurring here. And it wasn't that way. Like when we were in college, it was the experts say expert stuff. We all do it. That's changing. You guys have grown up with the internet, more digital information at your fingertips than ever before. Are you guys seeing, I mean, what we're trying to get at is, are you guys seeing expertise totally differently than a generation before you? That it's not enough to say, I've got the credentials, I have the chops, I published 3 papers, listen to me. That mom, in her child's experience, she is in essence an expert too. Is that, I mean, I just want you guys to wrestle with that and see how you think about that.
Nate and Hunter, I'd love for you guys to weigh in on what Tom's talking about here on expertise. Go, Nate.
Yeah, I mean, I wanted also to compliment Elizabeth on her distinction. I think it's a really important one and powerful one. Just thinking, I mean, in philosophy, we think a lot about intentionality versus outcomes. I think a lot of people have good intentions, but when we're talking like systems level, how can people act and how are systems acting through them? I think that's very different. So when we're criticizing maybe individuals are thinking about blameworthiness there versus structurally, I think it's a lot different of a conversation. But when we're talking about expertise, I think Dorian was saying a lot of important things about how people are experiencing things or how people are living things out. When I think about expertise or when I think about who's an expert, I really think about what's at stake for this person. So what do they care about? Why do they care about it is really important because, in philosophy, we talk, especially in ethics, we talk a lot about big issues, climate change, issues in public health. And we talk about millions of people and we do a lot of different thought experiments about, who should we talk about like trolley problems, right? Should we send the trolley this way and kill these people? Should we kill these people? And we talk very abstractly about these things, but they're having, real consequences for people. So what are these decisions? What kind of impact are they going to have on their life and the kind of life that they're living and experiencing? Does it come back to them or is it just going out into the world, into other people's lives, what they're feeling and experiencing? I think is really important because we can't treat people in the world like a thought experiment or abstractly, because we undermine them and we kind of bracket off what's really meaningful to them, what's important.
Thanks, Nate. Hunter, what are your thoughts?
I mean, I struggle with this a bit because my ideal, United States or ideal society is one in which our institutions are strong and I can have full faith in them. And I don't know whether it's that our institutions and our systems of expertise have gotten worse or if we've just gotten more aware For my grandparents, I think this goes back to the introduction to this conversation was a little bit about media. And my grandparents there were three people on TV reporting on the news, right? And that was their source. And maybe they read the New York Times in the local paper, and that was it, right? And so now anyone can be a viral award-winning journalist if they want to with the phone in their pocket. And so the sources of information are disseminated more broadly. You have more of an audience than ever before, and anyone can have that audience. That changes the way that information is passed around. So, for example, like I think Tyrone Hayes, he was a biologist at UC Berkeley. He came out reporting that atrazine, widely used herbicide, one of the most widely used herbicides in the United States, caused genital mutilation for gonads, right? And that maybe those kinds of studies were being done and just not reported on. And then what happened was his scientific credibility was questioned. Industry came to attack his credibility, bury him. It became a national story, very widely reported. Similar thing, Cancer Alley, Louisiana. It's called Cancer Alley because it's a stretch of land where there are all these, agrochemical plants. And the emissions and the chloroprene emissions from those plants are causing widespread public health crises of cancer like you wouldn't even believe. And yet the EPA says, oh, well, the levels of chloroprene emissions are sufficient. We don't think that there's a public health problem, despite the fact if you look at actual cancer concentration rate, clearly something's going on. Now, these things could have been happening in the past and not being reported on. But now with these platforms, they're disseminated, right? And so you hear that, you say, why the heck would I trust the EPA to tell me what is or isn't safe when I have this news story that's being, passed around and everyone's reading it? And so I think what needs to happen at this point, credibility is so important, but we need to make sure that those who are accredited properly. So I think one thing Secretary Kennedy's doing is he's trying to bring a nutrition education into public health schools. It's shocking that isn't there, right? Like we need to have nutrition education. I think this goes to personal anecdote. I know we're talking about, MAHA moms. My mother is a MAHA mom. What radicalized her and me probably towards this MAHA movement, when I was really young, I watched her get really, really sick. I think this happens so often. And she was getting sicker and sicker. And she'd go to these doctors and they would either gaslight her or give her another pill that would not work. And I watched her get so close to the point of basically death was a question in my own childhood when I'm a young, really young kid. And she had to discover for herself, randomly was asked to take a vitamin test without it even being in consideration, because her vitamin levels are on the floor. And so she'd been taking pill after pill and gaslit about her problems. And no doctor over the years had thought, maybe you should check your nutrition and your vitamin levels. And then she was able to cure herself. But the point being, if we don't prepare our experts to be as effective experts as possible, if we close the door on, whole fields of science and medicine, then we inevitably will lose that public trust because of how quickly information is disseminated. So because of all the attention and all the people who have their eyes out, we need to have more airtight institutions and credibility than ever before.
Thank you, Hunter, and thank you for sharing just some of the backstory in your own family. Maisa, I wonder if I can bring you in and just to kind of go a little deeper in what Hunter is saying. If, say, we are all working under the assumption that we want to trust our institutions more, right? How do we actually get there, right? Because sometimes I look at America as it is now, and I see that there's such a wave of sort of anti-status quo, pushing against institutions. Do we want institutions to succeed? Or are we saying we kind of want to burn it all down and start over? What do you think about that, Maisa?
Yeah, no, thank you. And I think that the point that you're making, Hunter, is really good because I don't really have a problem with institutions per se. I think that throughout history, there have been good institutions put in place, and then those institutions have been reformed. So I really believe in reform more than like tearing something down, because tearing something down causes chaos. And, we're political. As humans, we're political animals, and we really need like a political public structure. And I think it depends, is the public structure good? Does it need to be reformed? Right now, I have a lot of hope in that because I think that like Hunter was saying, we're being given tools to do our own research, but also we do have experts working in our favor. And it's also, the term experts is like, okay, are we going to say, I mean, there's good experts and there's bad experts. That's why there's dialogue. That's why there's, peer review. And are we going to have, experts that are blocking that peer review? Or I think that's what's important. So, and then kind of from a more individual perspective, I think that the current political situation with the MAHA movement has been giving a voice to kind of that more intuitive, holistic health, where that was kind of like it used to be. It's going back to like a more traditional view of health rather than trying to see what way to put this. More of like a holistic health that kind of for a while, maybe even 10 years ago used to be more fringe, like, things like sourdough bread and raw milk and beef tallow are like very popular terms right now. And I think that's great because those are things that I grew up on. And my family's Cuban. So my parents were born in Cuba. Then I was born in Miami and I go there all the time. My extended family all lives out there. And so our diet and our view of health in general was very holistic. It was very cultural. So it wasn't just like, oh, at mealtime we eat healthy food. It was like, no, at mealtime we don't talk about politics or bad news because mealtime is like, it's sacred, it's special, it's coming together as a family, it's an experience. And there was definitely a sense of balance, I think, where it wasn't like this, like, oh, you can't eat this, you can't eat that, you have to follow this diet, you have to follow that diet. And I think certain diets absolutely have a place, but if it's coming from, a foundation of, all foods are good for you if they're like in their nutritional form and, with a balance. I say it was a balance because Cubans, our desserts are very sugary. We put tons of sugar in our coffee.
Delicious.
Yes. It's amazing. We put tons of sugar in our coffee. My dad would have like an egg yolk in the morning in his wine, apparently. Like my grandfather did that too.
Oh my gosh,
I
Maya.
don't know if the egg yolk in wine or having wine in the morning is the headline there.
I don't know. Yeah, I don't even know. And then like my mom would give us like mulled wine before we went sledding to keep us warm. Anyways, and
but
then
Maya, let me ask you this,
visiting,
and this could be a question for everybody too, but we'll start with you if you have thoughts on this. When you step back and look at what's occurring here, so we have this marriage of MAHA and MAGA, is the current approach right now to reform these health institutions, or is the current approach as you see it right now, both from the administration, from RFK Jr., is the current approach to tear them down or to make them very weak? They can still exist. We're not like Department of Education, elimination mode, but really neutering them. Like, what do you see here?
Yeah, I think that they are in the process of reform. I think sometimes that does mean eliminating some things. I think in reform that has to happen. But essentially, I really do believe it is a reform. I don't think they're trying to tear anything down. I think
I got you. Does anyone on the call think more in the tear down, neuter side of things? Does anyone see that as what's going on? Or is it all reform? Like, what do you guys think?
Kenzie, I see your hand is up and you can respond however you want.
I really just appreciate the personal anecdotes that Maisa and Hunter brought into this conversation. And I will preface this by saying, for people who don't see my face in this moment, I am a Black woman. And that means that there's been very little reason historically for me and people who come from backgrounds like me to trust in the government, specifically health decision making. But because this is something that's so long standing, and I've been in the camp of tear down because the system was not built for me in the first place. And so building something new on a foundation that was not built for me will still produce a house that was not built for me. My question is, why now? Why the promotion of holistic health in this particular moment. Personally, I find this conversations like these so informative because I see MAHA and MAGA as two separate entities. However, MAHA is still very much enclosed in a MAGA administration, and we have to acknowledge that. But I'm wondering where all of this discourse about food justice, holistic healing, tapping into ancestral knowledge is only now being heard now that certain people are saying it. I feel like it's been co-opted from what indigenous folks, what Black folks, what other brown folks have been saying for generations and generations. And it's now just been essentially gentrified into this new language. And I think the idea of a citizen expert really only came into mainstream conversation because there were, frankly, white people who our society sees as more deserving of empathy, and maybe people of middle class or upper middle class that said, well, I should be in expertise in my own experiences. When the idea of people having lived expertise has been a core tenet of public health and health equity for so long. Going back to the Cancer Alley example, my grandfather, he is the product of Afro-Cuban immigrants, so solidarity there, but he grew up in Cancer Alley, in a parish just outside of Baton Rouge. And I can tell you right now that like Cancer Alley is not just a contemporary environmental issue. It is something that my people carry with them epigenetically. It literally is altering how their genes translate themselves and how that then like puts strain on even my body and could put strain on my children's bodies. We've known this in my family for generations. We've been the subject matter experts for generations, but I feel like in this hyper-partisan time, these sorts of issues are only now being brought up because certain people whose voices are deemed legitimate are sounding the alarm. Because I personally find it really difficult to reconcile wanting, better school nutrition programs with the cut in the supplemental nutrition assistance program, with the defunding of the Sunbucks program in the state of Indiana, which gave kids access to food during summer camp. As a health and science educator, this made the kids extremely antsy. So I see the direct effects of that. So I just wanted to raise that to the group.
Thank you, Kenzie. Oh, I know that there is so much interest in responding to that. Elizabeth, do you want to take that first? And then we're going to go around the horn a little bit.
Yeah. So first of all, thank you, I think, for framing it that way. I think it's so important that people do realize how much, time, energy, and passion has been poured into so many of these issues from our minority and underserved communities for generations. As Mesa was talking about, this is something that, holistic health is something that non-white communities have been practicing or still practice, to this day. And so I feel like often this modern conversation neglects all of the love and the passion toward holistic health, but also all of the frustration and the anger and the rage at our health institutions. I also think of, our Native American and Indigenous communities that have suffered so much at the hands of institutions. And so I think it's a very important part of the conversation. And, I actually kind of jumped in, I think, a little bit early whenever you had initially asked, why now? Because what I'm seeing is that for better or for worse, and I so agree with what you're saying, that MAHA and MAGA are really kind of two distinct groups that have partnered, I guess, and that we are seeing conflict in areas of funding for school lunches being cut, while we're also looking at, potentially trying to crack down on what can be served in schools, and how do we make these changes with less money. And I think there is a lot of confliction in those areas, but I also think that people as a whole regardless of color at this point, or where you're from, or your background, or your belief system, or your community. So many people are frustrated with our public health systems and just healthcare in general in this country to a point where it became a winning political issue. And, this isn't to say whether I do or I don't trust Donald Trump in terms of his intentions, but I do think it was something that he saw as an obvious winning political issue. And so I do think that's why we're starting to see it manifest now in this way. And I could come up with a million different ways that I would love, for these issues to have gotten the platform that they have, and to not feel that constant friction between conservative politics and what we believe is health issues that should be completely apolitical. But that's my assessment on how we got here.
Thank you. It was such an interesting point, Elizabeth, too. But to go back to Kenzie, what you were talking about, I think you're pointing to the reality that with people of color in this country, they were not afforded health systems to protect them, so they did it themselves. And now the do-it-yourself philosophy is being co-opted while cutting the very health systems that these communities were denied for decades, if not centuries, in this country. So it's sort of a double whammy, right? I mean, I'm oversimplifying, but is that part of what you're saying, at least?
Absolutely. And I can understand where this can be paradoxical, because the sort of DIY, do your own research, is an ethic that so many marginalized groups have had to take on. And when it comes to trusting the government for evidence, you would think that there would be people who would be against that because of ongoing tradition. But I think an important distinction to make is that the DIY approach to holistic health, at least from my point of view and my lived experience, that was a mechanism of survival. That was not because we wanted to do that. It's because the government forced us to do that. And so now, just using, raw milk as an example, now knowing that depasteurized milk has been what's causing people to become ill. Like, for us, we take that as good information and not necessarily a moral objection to how we've been doing things in the past. It's a way to be folded in to what I believe to be like a more representative evidence base, which is why the defunding of health equity work to diversify things like clinical trials, culturally responsive qualitative data collection, is very harmful and setting us several steps backwards. So yeah, I think the distinction between do it yourself as something that you're forced to do, and doing it yourself out of this idea of free will has a line drawn. And I think that line is historical privilege.
Adnan, can I bring you in, and specifically just give us your reaction just to this notion of reform versus tearing down versus, do you feel, just to Kenzie's point, who has these concerns about this seeming contradiction between defunding programs that could actually be used towards chronic disease prevention and things like that?
Yeah, so my perspective is a little bit simplistic. First of all, there are so many different factors that are causing this problem to exist. A lot of the time when we're looking at health, we're wondering, like, why did they just cut something that could have helped, like in nutrition for another person? And the issue with that is that a lot of the time there's sometimes, especially in this conversation, a lot of distinction between like acute medicine and chronic medicine. So they're trying to throw everything at a wall and solve one thing, which is chronic medicine. Like, people are deteriorating really fast, and at the same time there's still acute medicine and acute medical conditions that require cost and access and training to solve, which is like what most community educators do. They focus on acute care and acute training. If someone has like a condition in the community, or especially marginalized communities that have more susceptibility to one disease, they focus really on that, versus like what the government is currently putting a really big highlight on, which is chronic conditions and metabolic health and things that are a lot bigger than that, which is like, I guess where really the core contradiction comes. And that's what a lot of people are confused with. But at the same time, we also have to kind of, what I personally established is that decline is happening faster than any policy can change. So while in one hand, like the government can continue to throw a bunch of different policies, and then at the same time, there's a bunch of policies on the other aisle which are targeting like things that we don't want to happen. Regardless of the policy that's putting out, there is a very clear decline happening amongst chronic disease that is starting to become faster now than acute conditions. So while acute conditions have their own entire like issues, like we have people coming to the hospital with different sexual disorders, and people are coming to the hospital with all of these like diseases that have existed for, again, like Kenzie mentioned, like people have been trying to solve these DIY for a very long time. But today we're not just trying to solve issues DIY. I don't even think that the current like RFK community is trying to even push for necessarily solving your own issues in that sense. I think it's an entirely different sense, which is on the chronic disease side. Because again, like nobody has really tried to solve chronic disease issues DIY as much as they have in the past, or as even more than they have in the past. So for example, I'm an EMT. I see people all the time in the ambulance who are having their leg amputated, or I see an old man with dementia. I see somebody that has been sick for maybe the last 10 years of some really crippling disease. And at the same time, when they go to the hospital, the doctor or nurse just like sees a typical patient. Like this is the average thing that comes in. And so I think this is an experience amongst nurses and doctors and other healthcare educators. They see also like these things are normalized. You see an old man with dementia, and you're like, oh, he's just an old man. And so it's becoming very normalized. And in that way, it's like, how do we solve all of the smaller issues that are like facing marginalized communities in terms of acute care, while at the same time also coming to like accept the fact that we should not be having all of these older people crippled and having dementia and all of these diseases. And then I guess that's where like a lot of the issues come from. So as for reform, I think that it's really hard to reform a system where you're trying to solve two different things. But I think that like we kind of have to at this point reconcile with both ideas and realize where they're coming from, because I think they're coming from that aspect of like chronic disease for the most part.
Does anyone want to, before I bring Hunter in, does anyone want to respond to the idea that chronic disease hasn't really been taken on in the past in this way? Rotimi, what do you think?
Yeah, I'm actually very interested in chronic disease work. So I'll share a little bit of my background. I've done a lot of work in health financing and care delivery. So from the health financing side, I work with North Carolina Medicaid on what we call value-based care arrangements. And so essentially that kind of gets to some of your earlier points about trying to align financial incentives with providers in terms of being aligned with patient interests. Because as you mentioned, sometimes providers were making more money when people were sicker. And that's something that was very problematic. So what the Affordable Care Act did was it set up a lot of incentives for organizations like ACOs or accountable care organizations, where you're seeing explicit links between the payments providers are receiving and the outcomes that patients are having for things like chronic disease. So I think that chronic disease management, it's something that has not historically been incentivized in the US health system, but to create those changes, a lot of these structural incentives will need to come from people with the market power to do so. So Medicare is a great example. Medicare is one of the largest payers in the US healthcare market, because once you're 65 or older, you get access to Medicare. And as a result, Medicare is able to be a leader in terms of helping to drive hospital-wide shifts, healthcare system-wide shifts, because it's like if these systems don't get on board with trying to improve disease management for their patients, then they're not going to receive as much reimbursement as they would like. And you don't necessarily see individuals that have that power to actually just like, as an individual myself, I can't go to a hospital CEO and say, I need you to make this change and incentivize chronic disease management the way that Medicare can, because they have millions of people on their payroll. And so that's something that also worries me today, because the government itself has so many opportunities with its large structure to incentivize large-scale changes. And as Kenzie kind of touched on earlier, while MAGA and MAHA are like distinct concepts, they are very joined together. And so I think it still goes back to that tension. The questions I have today are, if we're so interested in reducing chronic disease, then why are we crippling and underfunding systems that could do that? Like Medicaid, for example. With the Medicaid cuts, we're going to see in North Carolina alone, 600,000 people could lose healthcare. Those are 600,000 people that could lose access to primary care at the doctor, 600,000 people that could lose the ability to get screened for diabetes, to receive medications that they might need. And as somebody who volunteers at a free clinic every week with some of the patients who don't have access to primary care, it's deeply worrisome.
Thank you, Rotimi. Hunter, do you have any thoughts on this?
Yeah, well, I do want to say to Kenzie, first of all, I'm very touched to hear about your family's connection to Cancer Alley. And at a different time, I would love to talk to you about that more, because that's an issue very close to my heart. And I really appreciate what you have to say about. I mean, I guess I'm full of anecdotes today, so I'm going to provide another anecdote. When I was really, really young, in kindergarten age, I had, like so many people and so many kids, really adverse reaction to artificial dyes. I was, had like bouncing around the walls and full meltdowns, this kind of thing. And so what I did was I penned a letter, in my rough kindergarten script to the real face, the person who was really advocating for health at the time, and that was Michelle Obama. And this was before there was MAHA, there's Let's Move, right? And it's many of the same policies that were, carrying Secretary Kennedy around. That's not that we shouldn't carry him around and say this is amazing stuff. But, in 2010, these things were being worked on by, frankly, a woman of color. And it didn't happen like it's happening today. And so I think that that's something that I've been very aware of in my time. That's sort of like disappointment then. I was so happy to see artificial dyes, the way they're being taken off the market gradually one by one. Now it's a fulfillment of wishes I've had my entire life. But also I'm cognizant of what factors are at play, right? And so that's definitely an important thing. Now, the counterpoint, though, is I think as we talk about the MAHA, MAGA sort of strange bedfellows kind of thing, and that what that coalition means, is that we do have to remember that Secretary Kennedy dialed Kamala Harris's campaign and she didn't pick up the call, right? Like that happened, and he called both camps. And I think Andrew Yang, the former presidential candidate at the time, was saying, Vice President Harris needs to talk more about the chronic disease epidemic because this could be an election deciding issue. And so I think if you'd asked me like a year ago or 2 years ago, if I thought that RFK Jr., who was treated as too far left to run the EPA when Barack Obama got elected in 2008, they said he's too far left and extremist, would be then on the other end of it. I'd say that's the statistically unlikely outcome. And I'm not sure if that's, entirely or sweepingly true. But another thing is, and I want to acknowledge the frustration of, why have these messages been co-opted? Who is the face of MAHA versus who's been the face of these issues for such a long time? But I do think there is something to be said that no one's talking about MAHA dads. It's MAHA moms. And why is that? Because frankly, like there is medical gaslighting and medical sexism so concentrated on women, right? One of my closest friends is a student in public health school at University of Michigan, big fan of that. But she will come and tell me week after week these things that she's learning about how horribly women have been treated by our health system. So yes, talk about the foundations of the house, definitely not built for people of color, not built for women either. And so I think when you have a bigger, like there are more women totally, it's like half the country, more than half the country. There is a part of that where it's like women as a whole rose up. And I think this is the product of women's work, much more than the product of men's work, of this sort of reclaiming health and recognizing that the foundations weren't built for them. So I do think that there is that sort of oppression dynamics at play, just maybe with a different group.
Kenzie, do you want to respond to some of this? I know specifically we've heard Michelle Obama's Let's Move campaign come up. And actually in previous episodes, there have been MAHA supporters who said back then they were Democrats who supported the First Lady and were really cheering her on. And it was a very different Republican Party back then, and they were very obstructionist towards those policies. But Kenzie, what do you think about that and some of the other things that Hunter was saying?
I have so many thoughts, and I'm afraid that they're not going to be entirely cohesive. But one thing that I really want to do first and foremost is lift up something that Rotimi basically, I don't know if we could say that he dropped it in the chat, but like I just learned from Rotimi, which is that the Secretary of Health and Human Services works within a different domain and has a different locus of control than the First Lady. And due to Hunter's point, like a lot of gender dynamics and perceptions, I think that First Lady's campaigns a lot of the time are treated more as passion projects, and therefore it's a lot easier to dismiss them as partisan initiatives. But to the point of partisanism, and I'm wondering too if Nate could lend like a philosophical perspective on this, the idea that RFK Jr. was once deemed too left to run the EPA really, really fascinates me because he's doing something that I see a lot of politicians doing, which is actually switching their party affiliation based off of how high up they believe their platform could be. But the ethos of what they're saying, the heart and the logic of what they're saying remains the same. And so kind of like a philosophical, ethical question that I have is, is it considered, is it just, is it reasonable, is it strategic even to switch party affiliations to get across a message that you've been preaching for a long time, but was dismissed because you were affiliated with a different party, a different identity at the time?
She said ethics. We have a bioethicist in the house. Nate, what do you think?
So I think there's a lot of opportunism that's coming out of this. So I think there's, what is politically feasible that they had to do. And, I think the calculation that MAHA has to make is how much are they giving away in the process of this to elevate, their figurehead into the largest and the most powerful health office in the US and to become the health czar. What does that mean, giving it away? Is MAHA even the same that it was before? I mean, we always see that any political movement or any political party is very extreme during elections. And then there's what can you build out into policies and what is that reality? Is it ethical? I don't know. I think there's a lot of decoupling in conversations about public health and like politics and, people saying that these are nonpartisan or partisan issues, which I think in philosophy of public health, we recognize that public health is inherently political by its nature because it works by the police power of the state. So when we talk about like the FDA getting rid of food dyes or et cetera, right, you have to enforce that with the state. So those things, they never really come apart and we have to see them as one. I don't know if I'm answering your question.
Yeah, you are, but let me play the voice of MAHA. We all bemoan this two-party system and everyone's, on one team or the other, and they can never cross a line because they have to stick with their team. And it's better for the party and putting the party over the country. Robert F. Kennedy saw an opportunity, saw a way in which his cause could be elevated, that he could make a huge contribution by endorsing Trump. Yeah. And it led to him being the head of HHS. Like, why is that? Why don't we celebrate that? And it's given him, he doesn't have to agree with everything in the administration, but it's given him a huge platform to affect the changes that he thinks America needs, and he's trying to do it to save lives. So that seems like a really good thing, right?
I mean, I think there definitely is, overlap between like MAGA and MAHA in this in libertarian thinking and kind of, pulling back from the state, running people's health. So I think there is alignment there. Hunter is right that maybe Democrats really didn't take him too seriously or didn't see how much of a priority it was to voters, which they did with like a lot of different issues. But I think it's this coupling or this pairing, it's really, I guess, made the libertarian part of MAHA a lot more extremist than it was before, or a lot more, it comes out a lot more than it used to, because that's how they're pulling in the MAGA people. So I don't know if MAHA has been deformed or distorted from what it originally was, or if you can even call it the same movement anymore. I mean, that's what happens when you build political coalitions. But, I do personally think like a lot of these things have been extremely damaging. I think it has been a tear down in a lot of these institutions that have delivered outcomes, not perfect, but have delivered something worthwhile.
Kenzie, do you want to take a crack at that?
Very quickly, I would love to respond to Tom's query of shouldn't it be celebrated if someone then takes an opportunity to preach a meaningful message and then attach it to a different party affiliation, align themselves with Trump, for example. And for me, simply put, my response is tell me who your friends are and I'll tell you who you are. Because MAHA at its core has an opportunity to be fundamentally anti-racist, to fundamentally be socioeconomically equitable, to bring gender justice into the conversation. But if you're operating within a bureaucracy at which the person at the top of the bureaucracy doesn't believe in those core tenets, then it's hard for me to imagine a world in which all of these things can be implemented in a way that benefits everybody equally, and which the justice potential within MAHA is actually distributed in the way that it needs to be distributed. And again, at the risk of sounding like a broken record, I think that one kind of untouched upon potential for things like clean food is the realm of reproductive justice, protecting maternal health. And this is an example. Seed oils have been on my mind a lot lately because there's this push to eliminate seed oils. There's an evidence base that does support the elimination of seed oils. Most baby formula has seed oils. The easy fix would be, well, of course, that's why women should breastfeed. But if women themselves are malnourished, if for some other reason they don't have the capacity to breastfeed, if they adopted a child and so they don't have the breast milk that comes from pregnancy, what are we doing on the other end to support maternal welfare and also supporting child welfare so that we could say something as like base simple as we need to eliminate seed oils, and that actually be something that's actionable for everyone. And I just want to say that thinking of all of these issues as interconnected, as all policy, as food policy, as all policy, as health policy, have been at the forefront, at least within marginalized niches of public health work for generations at this point.
Hunter, do you want to comment on that real quick?
Yeah, I think, the point of maternal health and reproductive health is such an important one. I do think, though, like, we have, Secretary Kennedy's been working on Operation Stork Speed, right? Recognizing exactly what you're saying, that our baby formula is no good. They have heavy metal problems, content problems, that sort of thing. Baby food in general it's just really a horrible, mixed bag of just terrible chemicals and things like that. And so I do think that was one of the first things that MAHA went after. And I don't think that necessarily administration from sort of the MAGA side has been opposed to that or digging their heels in on that. And I don't think that's not to say, I understand the concern of, show me your friends and I'll show you, who you are. I'd also say the counterpoint is politics makes for strange bedfellows. I think sometimes I would rather have, I don't expect that in the next 4 years you'll have an equitable, equal distribution of benefits from this health revolution. I don't think that that's realistic. That's not saying that you shouldn't expect it or demand it or work for it. But I think I would rather take incremental gains in health equity that sort of impact, those most directly impact are mothers, farmers, those kinds of things. That's where the greatest concentration is to those who've been historically disadvantaged. I'll take a couple wins, even if I'm not happy with, how everything turns out, as long as we sort of break even and end up over the top just a little bit.
Thank you for that, Hunter. So I want to spend the last part of our conversation talking a little bit about something that just happened that particularly I think has impacted the Gen Z community. The killing of Charlie Kirk is something that we've talked about on the show, and we've talked about it particularly in relationship to discourse and engaging in discourse, particularly with people who we disagree with. And I want to play for you something that the Republican governor, Spencer Cox of Utah, said recently when he was giving a press conference announcing the arrest of the alleged shooter in the killing of Charlie Kirk. And we heard it and we thought it related to our subject of health and trust. And we were wondering kind of what you heard. And so let's listen for a second to what the governor said, and we will get your reactions.
Social media is a cancer on our society right now. And I would encourage people to log off, turn off, touch grass, hug a family member, go out and do good in your community. That is happening, and it's happening organically right now.
Adnan, let's go to you first. He's talked about touching grass, but also, what did you hear in what Governor Cox just said?
Yeah, I thought that was really funny when I heard it the first time as well. I thought that was really on point. But I think what he mentioned in that is also from where I come from with touching, like the whole idea of touch grass in general, which is that basically nowadays everybody is invested on social media. Everybody's watching every single narrative that comes out, and this relates to health as well. Like people know everything that comes out with the MAHA field. They also know what's happening with some person that's having a sickness in Idaho. Like we have we're able to know what's going on in any state nowadays, and so young people are constantly just on their phone scrolling and seeing all this thrown at them. And it kind of comes to the point where because of this, we're constantly in our minds. Like we are always internalizing these thoughts. And we're always hyper focusing on like whatever's going on. So like, for example, Charlie Kirk's death is something that almost all young people right now have thought about, whether or not they're Democratic or Republican. But at the same time, why are they focusing on that versus another, like something else that might have happened in another place? That's because social media can amplify these things so much. It can push it onto us and make us like really focus on it. We can see the video of what happened to him like in our own eyes. And it really brings us to this very spiritual death that is happening where we see this thing happening and then we internalize it, and sometimes we don't even react to it. Like we're so used to seeing these kind of things that it just goes in one ear and then it does something that we can't even see to us, and then it goes out the other. And I think that's really dangerous. So I like that he said touch grass, because I think people are not going outside and taking time off of their devices, which are also like actually grounding themselves in the physical world and getting away from like the internalized thoughts and actually all these memories of what they saw happen to Charlie Kirk, and actually go out into the world and feel it. So I agree with what he said in that aspect. I also think that prior to Charlie Kirk's death, I think the fact that people weren't touching grass and are logged in is also something that contributed to what happened to Charlie Kirk. And I also think it was one of the main things Charlie Kirk fought against, which is this very, very, very large spiritual death that's happened in America, across the spectrum. I mean, not just faith-wise. I mean, also as on the individual level, people are very, very, very sick, very online, and they're kind of not understanding how to grapple with really big thoughts. And so sometimes it ends up with a 22-year-old doing something really vile, that he shouldn't have done. And it kind of points at this very, very large spiritual sickness that is happening.
Thank you, Adnan. Rotimi, I wonder if I can go to you next to just, how have you been sort of reflecting on the murder of Charlie Kirk, civil discourse, and then what the governor said there?
Yeah, well, first I just want to begin by condemning political violence and gun violence full stop. I don't think any of us should accept this as normal, and it worries me that we're seeing increasing incidents on both sides of the spectrum occurring. What I will go in to say is I think the idea of telling people to touch grass is a little bit dismissive, and it ignores some of the system's thinking levels. So going to social media first, I think whether or not we like it, Pandora's box has been opened, and social media is it's a very large new medium. I'm very active on social media, but I think the idea of blaming social media for gun violence itself could be a little dismissive. I think that maybe instead the idea is that social media can amplify existing mental health problems. And I think that's something, if I'm not mistaken, that's something you agree with, Adnan, as well. We see these echo chambers, we see a lot of confirmation bias. We don't see a lot of regulation of social media algorithms. There's some debates over censorship, what is safe, what messages are safe to have on social media, what messages aren't safe. I think the first idea for me is that we need greater regulation of social media. I think the second idea for me is that gun violence is a public health issue, and that we're not seeing enough done in our regulatory frameworks to identify gun violence as a public health issue and to act upon it, from restrictions on research from the CDC into looking into gun violence as a public health cause, all the way to restrictions and inaction in federal agencies and legislative bodies on things like red flag laws to make sure that people who might not have the same sensor, if you might be prone to mental health challenges, maybe being on social media isn't the best thing for you 24/7. I think the same thing would be true for guns, where you have the power to actually go and kill somebody. And then lastly, with the idea of touching grass, I think that if we really want to reduce gun violence, it's more than just saying touch grass. It's more than just saying thoughts and prayers. Those are cultural flashpoints. Why would we defund the EPA? Why would we encourage development on land that can be used for fossil fuels, and reduce the amount of oversight and reviewing that we're exacting on these agencies that are responsible for reducing the amount of grass we even have to touch? So I think there's a lot of thoughts within this, the aftermath of the shooting. But yeah, I definitely am disappointed to I think this can be a great catalyst for change across mental health, across gun control, and even touching grass and getting environmental access. But I haven't seen that systemic level response to it. I've been seeing a lot of finger pointing, the cultural flashpoints and blaming, and it's very disappointing.
Wait, Hunter, you just put something interesting in the chat, and I as somebody who is Gen X, oh my God, I want to learn more. You said that touch grass is like that Gen Z uses that phrase a little bit differently than perhaps what the governor intended. Please educate me.
Yeah, so I mean, Gen Z, I feel like if you tell someone to like touch grass, you're like, oh, you must have never gone outside. Like you probably sit in your room all day, like you're way on your computer too much. You should go out and like literally stand in the grass because that'd be such an event for you. It's like it's an insult. Like it's like I think very
It's a
widely
dig.
used, in like online arguments or that kind of thing. I mean, I think that connotation, obviously, I don't think that Governor Cox is saying like, oh, you screenagers, like get out and stand in a patch of grass. Like you guys are on. I mean, like the general message is the same, which is that there's probably an overusage and over reliance on screens. But I think when we interpret that, like, when I hear touch grass, I chuckle to myself, but also I'm like, that has a very different, like in sort of the discourse of, young people, has a very different meaning and perhaps a more comedic meaning than I think used in this context, which is we have societally are overly interconnected to this sort of fiery discourse and stuff like that that's ultimately damaging. That's a little more nuanced and a little bit more advanced discussion than I think that term evokes.
Interesting. Oh my gosh, I'm learning so much. Dorian Johnson, you wanted to weigh in on Charlie Kirk, discourse, social media, all that.
Yes. And I do want to just start off by, like, personally, I am not a fan of guns at all under any circumstance. This is like a personal, like, belief of mine. But when I also think about it in the context of American culture and symbolism and what it means, like, I feel like there is such a blurring of gun ownership and rights and freedom and what it represents. But I also feel like you could create that meaning for like other objects. I feel like it's just something that is so to the core, like American. It's like something that needs to be confronted and addressed. Also, when it comes to him being murdered and just like what social media, how they responded, let's say, I do remember distinctly, and it was still pretty early. So like it could have been like a non-fact check thing. I want to practice benevolence here, but I do know there were people and narratives that were formed where it's like, this man got murdered in front of his wife. Like, that is awful. Like, his kids saw it as well, where it came out later, Erica confirmed that she was not there. But what that started with the narrative power of how much more vile this already vile act was because it was in front of his wife. And therefore, like, I feel like it was a breeding ground for specific, like, narrative and rhetoric to be pushed in a way. It just is an interesting, like, how people are responding on social media and at the time of when things happened. But also it could have been rooted in something that wasn't entirely true. But that still doesn't detract from like how awful that act was.
Nate, go ahead.
So I think that like how Gen Z has been reacting to, being told to touch grass versus, let's say, the governor of Utah's generation. I think that kind of speaks to what social media does to us and how it kind of makes us react more. That's something that I think the governor really meant, calm people and make them feel better. In our generation is something that we kind of even take offense to. And I think that speaks to, the extremism that social media creates. And I think it's really interesting. I am chronically online, as anyone in my generation. So I'm victim to that. I'm not immune to that. I will be honest. I did not want to be here today. I did not want to have this conversation because why? Because I did not feel comfortable leaving my echo chamber. But, I think that was my impulse. And when I got all philosophical about it and reacted or thought more about it, I thought that's the really wrong impulse, but that's the impulse that a lot of us feel. And I think, I feel a lot more comfortable with conversations like this in the future, just because we had them, but I really haven't had that kind of opportunity in the past. I do think, the gun violence question needs to be thought about more. I'm an African American from Baltimore City, so I'm familiar with gun violence. I've actually had a close family member who was a victim of gun violence in my car. So I had to drive a car covered in blood. So those, and I think it's disappointing that, it has to be a public figure, because I feel like I've seen people and I've seen literally the consequences, right? Blood, right? Smelling it, right? Feeling it, right? Cleaning it up. I think that now this conversation is happening, I think is a little weird, or, in these little, and that's kind of the sad part of like social media, is because what happened to my family is not really interesting. It doesn't matter as much because it's not as flashy, right? So, those are my thoughts. I think social media, gun violence, right? Everything is amplifying itself. We can't, like Dorian say, really decouple American culture from guns. It's just really part of us. So, how, I don't know if we can get rid of guns, but what does our relationship with guns look like is something that we really need to talk about more, especially in public health. I see it even neglected in mainstream public health and different conversations. So, yeah.
Thank you for that, Nate, and thank you for sharing your story. In conclusion, I have one more question that I would love for you guys to think about. One of the things that I notice a lot of people talk about Gen Z and how to reach Gen Z all the time, right? And one of the things that we hear is like, make the clip shorter. Shorter is better. And they don't have a good attention span. So you really got to kind of get in there fast and make it flashy and whatever. And maybe I'm not reflecting the like best iteration of that argument, but I mean, I'm sure you've heard all that. So I'd love to just end with like, how do you want to be spoken to? What resonates with you? What do you tend to gravitate towards? And I know that you're not a monolith on this call, but you're here. So tell me about that. Who wants to go first? Hunter, go for it.
Sure. I mean, I think in my mind, you kind of have to treat Gen Z as two different generations. I think you can look politically, I think is the best indicator. There is a pre-COVID Gen Z and a post-COVID Gen Z, and they diverge drastically politically. I think there was a Yale study that showed, I mean, crazy for the Gen Z that's like directly younger than me. So I'm a sophomore in college, like sort of post like 2006 onward, that Gen Z is so much more conservative, for example, than the Gen Z that's like sort of my year and like right older. So like I'm a sandwich right between. So I think when you talk about reaching, and I'm interpreting this question on sort of more of a level of the issues and how do we engage Gen Z in the issues, I think your involvement with that is entirely dependent upon what your relationship with COVID was and what your relationship with that time period was. Because I understand it like, and that's also regional, right? What was your lockdown experience like? We so quickly brush past the fact that developmentally that time period was so like society reshaping in terms of impact on development, growth, maturity, et cetera. And so when you talk about engaging Gen Z, I think you have to say, all right, why is it that my younger sister is more suspicious of authority than I naturally was? And that's another anecdotal example, but then all of her friends are similarly so. It's because you have to concede that there's going to be that suspicion of authority and that suspicion of institutions in a way that you might not talking to someone who's, born in 2003, 2004. And so I think you have to adjust your approach to Gen Z contingent upon when they went through the time that they went through when COVID was sort of involved and all those, sort of those like early 2020s years and how they experienced them.
It's interesting. It reminds me of, the baby boom experience pre-Vietnam War and sort of post-Vietnam, or at least late Vietnam War, post-Vietnam War, sort of just two different, views of establishment, of government, of service, of what it means to be patriotic, what America's all about. Like it was just two different generations, really.
Kenzie, can I go to you next on that? Just this idea of reaching Gen Z. I mean, what do you look for in how people reach you?
To me, this is almost an emotional question, and also a very human matter, because I think fundamentally what we're grappling with is the need for people to feel heard, seen, visible as individuals, while also being able to trust that the evidence base shows that individual experiences aren't the collective experience. And the way that policymaking especially operates is that we go with, ideally, we'd go with the collective experience to benefit as many people as possible, even if that doesn't directly benefit you, because your experience might be, the outlier, or your experience might not be the quote unquote statistically significant one, which we don't have like a lot of time to unpack here. But I think that the most important thing we could do, we can take the time and patience to study, is how to make sure that we see people for who they are, and a rising tide lifts all boats. So even if you had, for example, this adverse, reaction to a vaccine, let's say the COVID-19 vaccine, the evidence still shows that the COVID-19 vaccine saved more people than it could have ever killed if the virus itself has, if the vaccine itself is able to kill, because it's not the live attenuated virus and it's not even a dead virus. It's mRNA replicating the virus. So being able to tell people like, yes, I see you, I hear you, and try to return, maybe not even return, get to the first place, to a national spirit where we say, my lived expertise, what I'm going through is just a piece of the puzzle, but I want to move towards society where if my child, if my neighbor, if my coworker represents a different piece of the puzzle that could be even more harm than I am, then I'm willing to abandon personal needs for now to lift them up, knowing and trusting that when it's me, when it's my turn to be lifted up, people are going to lift me up. In a very bipartisan society, that sounds very pie in the sky. That sounds very idealistic. But yes, and language. Yes to MAHA and health justice. Yes to holistic healing, and acknowledging that holistic healing has existed in several forms before we even came to the United States is so important. Reassuring young people when, like, I'm 26, elder Gen Z, don't know what I want to be when I grow up. And like a space where it's like I feel like I have to have everything figured out, having the elders, the older people in our life, maybe even the millennials, the Gen X, remind us that cognitive dissonance is a natural part of the human experience that makes conversations like these beautiful rather than frustrating, is so important. Like, let us say, I don't know, and not feel like that makes us a bad person, if that makes sense.
I'm so moved. I just want you guys to know by this whole conversation. I'm, anytime I get a little worried about my kids and the future that awaits them, I think we're going to be okay. So, take us home, Hero Timi. And I'll just say this, which is this notion that shorter is better. And this notion that that y'all just look at TikTok and social media, is that true, Rotimi? Speak for your whole generation. Go.
Somebody who cannot speak for my whole generation, but has roughly 39,000 followers on TikTok, a bit too much screen time. I think that idea is a little bit nuanced in the sense where it's not necessarily that shorter is better. I'll find myself watching 10-minute TikTok videos. It's that fluff is bad. I don't want to watch 1 minute of what I want to see and 9 minutes of fluff. I want people to get to the core message. And so for me, I think that comes back to the idea of authenticity. And I think that across political spectrums is what people are interested in now. And maybe that aligns with the lack of, or the loss of trust in institutions, like him or not. I think a large part of Donald Trump's appeal is that he comes across as a very authentic person. You see the same thing on the left with someone like Zoran Mamdani in New York. The politics are worlds apart, but their electoral wins are fueled by people who feel like they're being seen and getting the real help. And I think that's what we really want. Validation that our feelings, whether it's our fears about our health, our families, our future, are real. I think the leaders, they can be wordy, they can be short, but I think the worst thing they can be is dismissive. I think platitudes feel like an insult. Like, don't just tell me that a school shooting is sad. UNC had a shooting event 2 years ago when I was on campus. It was incredibly scary. I want to see you showing up in your district and comforting families. I think you need to show that you're fighting for the systems that are inflicting harm against people. So it's like, that's my ultimate test. And so bringing this podcast back to the through line and thinking about like, is what's happening today effective? I think if you're someone like Secretary Kennedy, who has these incredible goals to make America healthy, a lot of the goals I agree with in terms of reducing chronic disease and removing environmental toxins. But you're in an administration that's also simultaneously defunding safety nets and removing environmental protections. I think your only authentic path forward is to just be honest about that conflict. You know, to earn my trust, I need to hear you say publicly, I disagree with my administration on this, and it will harm the people I'm trying to help. I acknowledge that it is antithetical to the goals that I have. And I want to hear what you're doing within your constraints to fight it. We know that the system is a machine. We know that party lines are very tough. We know that America is increasingly less bipartisan at the federal level and decision makers. But we are still desperate for defectors and people who can operate within that machine and show us transparently where they're signing and prove that they're fighting for us. I think that's going to be the key to reaching Gen Z, and that's going to be the key to political wins. Show us that you're more than a system, that you're a free thinker, you're an independent feeler, and that you want to be transparent with us. It's authenticity and leadership.
Thank you so much. Listen, y'all, I want to thank you so much for joining us on Why Should I Trust You? I can think I speak for all our hosts in just how kind of blown away we are by all of you. You know, I want to thank Kenzie, Maesa, Adnan, Hunter, Elizabeth, Nate, Rotimi, and Dorian. Did I get everyone? But thank you so much for joining us, and Why Should I Trust You? I'm Brinda Adhikari. He is Tom Johnson. She is Maggie Bartlett. Mark is going to be back with us on the next episode. Please send us questions, comments to questions@whyshoulditrustyou.net. We will see you right back here next week.